This is Haley Hopper, the physical therapy preceptor with AW Healthcare. I'm showing you today how to complete a physical therapy home health evaluation note. So right now we are on our timesheet, our daily timesheet, and we're going to start the note by clicking eChart. It will prompt us to time in. From there, we'll start at the top. So incident report, if the patient's had any falls or medication problems or changes, or if the patient's been diagnosed with a new infection, we'd want to click yes and report the incident. If not, we can click no. Can time will require us to choose 3 patient identification options here. Select patient tolerated session, standard precautions observed. You cannot submit the note without selecting these things. It will prompt you if you forget. We'll scroll down a little bit. So mental status will address. Vital signs are important to address. Home health requires us to take vitals. So we'll want to enter a temperature, we'll do a heart rate, blood pressure, and I'm going to make this outside of parameters so it'll prompt us at the end. Okay, so if the patient is outside of parameters, we will need to call the physician and notify the physician within the same day. And we'll have to document that in care coordination. And we'll want to document, any new instructions from the physician. Normal range will be here. Scrolling down, COPD and CHF, we will need to monitor these even as physical therapists if the patient has these diagnoses. Especially if the nurse is not in or no longer in, we'll want to check in with the patient. If they do not have this diagnosis, you can say NA, but otherwise you'll want to address it. So these blue pencils are the quick text icons. You can click there. It will give you some potential therapy-related interventions or education options for these diagnoses. Same thing with CHF. We'll scroll down. You can ignore medication. You can ignore the diagnosis codes. We have somebody that will do the coding for us. Scrolling back a little bit to COPD and CHF, while these two are specifically identified, we also want to look out for patients that have diagnoses of diabetes or depression or have a history of falls and pain. We are required to address those things as well if they're present. Most of our patients will have a history of falls or at least a high risk of falls and pain. So we'll want to make sure we comment on those somewhere. Okay. Scrolling down. Living situation. So throughout most of our notes, we'll have options for quick text to help give you guidelines for the documentation that's expected. So PT recommended documentation is what you're looking for. So it tells you what we're expecting in each of these boxes. Prior therapy received, same thing. Prior level of function and medical history. We're also looking for the patient's goal here. Reason for evaluation. Here's an example of a script for that. You don't have to use it, but again, it helps guide what we're looking for. You can ignore MD visits. Okay, pain. We will need to fill out the Wong-Baker pain assessment with every visit, even if they don't have any pain. So I'd recommend just clicking See Wong-Baker form. A little further down, gait analysis. recommended documentation. Then we'll have muscle testing. If we are not addressing the upper body because OT is involved, you can click NA. Then we'd fill out muscle test scores, range of motion, any comments related to pain. You can write down here. Then we'll get to our transfers. We use the functional independence scale, so it gives you kind of that code here. You can comment on assistive device used. Down here you can comment on, any cues provided or any things you noted. All right, sensory skills. So this is kind of a catch-all for anything with sensation. So proprioception, sensation, vision, hearing, safety awareness. You can comment in the box or you can fill out any of these. Sitting balance, this is just general balance description. So you want to say their sitting balance is fair, standing balance is poor. We might say patient reports 2 falls in the last month. I will need to comment something here. Okay. Ignore standardized tests. It's tempting to use this button, but it won't give you the test that you need, so I would ignore it. Standardized test summary. So here's usually where I'll stop and I'll go back up and enter my forms. We request that you do 2 standardized tests. So maybe I did a Tonetti and a tug. Okay, I'm going to scroll up. I'm going to use these little arrows down here. I'm going to save before I change screens, and I'm going to go to forms. So this will bring up a list of forms. So you'll see some of the other clinicians. Their forms are here. I'm going to add a new form. I'm going to add the Wong-Baker because it's required. I'm going to say this patient doesn't have any pain. Now we want to make sure we're documenting on the patient's pain in the last 24 to 48 hours. So if they've had pain and they just don't at this moment, we'll want to make sure to document that. Save and submit. And then you can close. It'll show up here. Then we'll need to add the HHA COVID screen. This is also required. So we'll fill out this form appropriately and then sign it at the bottom. Save and submit. And then close. And then we'll say you can add the Tonetti in here. Any other outcome measures will be in here as well. We'll go back then to the patient's eval. Scroll down. Okay, we're back at our standardized test summary. Okay, DME and supplies, safety measures, functional limitations, and activities permitted will all be filled out from prior, from the start of care. You can add to it if you want to. If you see something that the start of care clinician didn't see, you can add to it. Then we'll want to address homebound status. So if we're receiving home health, the patient will need to be homebound. Click appropriate reasons, and it will also require that you comment on it. So again, using the quick text, PT recommended documentation, patient is homebound secondary to blank. Rehab potential, this will be here copied over from the start of care. You can change it if you feel differently. You can ignore supervision and conferences. That doesn't really apply during an eval. Then we're going to go to our summary. So this is where you'll write your summary of your visit or your eval. You can use kind of our script here, use your own. I'd recommend copying this because we'll need it later. Okay? We'll want to copy that into a care coordination note at a later time. So copy it. Then we get to goals. A couple of them are already there. So to do that, we'll add from library to get our goals and interventions. Select our discipline. So under general, there will be a COVID goal and intervention. We have to add a COVID goal and intervention. Under musculoskeletal, there'll be a fall prevention goal and intervention. If the patient has a risk of fall, which most of our patients will, we will need to add a fall prevention goal and intervention. If the patient has a history of pain of any kind, we'll need to add a pain goal and intervention. Then you can add whatever goals you think are appropriate. You can go under exercise, function transfers, gait, balance. So I'm going to go here. I'll choose a different one. So range of motion goal, short-term goal, long-term goal, intervention. Some of them have already been used, so they wouldn't show up here. You can edit your goals here in the boxes before you select them, or you can edit them on this screen. So most of our goals have been selected already. Once they've been chosen, they won't show up in the library anymore. Long-term goals. And then short-term goals. So short-term goals will give you an option to comment on their status or interventions provided this visit. So on eval, there's a lot of education. So I'll usually comment on education or exercise instructions that I gave during this eval. If you want to comment any more on long-term goals or on other interventions, you can scroll back to the top. Click on those tabs. Here's interventions. Perform intervention. This is the COVID goal, or intervention screening done. Save and close. Goals. Those are our short-term goals again. There'll also be long-term goals down here. If a goal's been met, you can click Goal Met. And then scroll back to the top. Don't click Goal Met on your COVID goal because it'll require that at every visit. Save. The main thing is that we do comment on interventions provided somewhere within the note, whether it's an interventions goal or on the eval tab. On that short-term goal section here. Okay, moving on to summary. You'll want to select anyone you've contacted with care coordination, any other disciplines, their rehab potential, discharge plan, client to achieve optimal function, discharge discussed with patient and care manager are aware of the plan. So that's a big one. We want to make sure we discuss our planned frequency or what we hope to be our planned frequency, and what we're going to work on with the patient. Physician acceptance of plan of care. Here we'll write pending because the patient hasn't accepted the plan of care yet. They haven't signed off on it yet. And we don't know for sure what our frequency is depending on the insurance. Skilled treatment provided this visit. You can use, again, your own or PT recommended documentation. Just make sure when you use the quick text that you check to make sure what is in there is appropriate to your visit. Plan from prior visit and best practices from prior visit we'll have copied over from the previous visit. Plan for next visit. Best practices. So this kind of goes back to, here's your PT recommended documentation. Delete the ones that don't that aren't appropriate for this patient, but we'll always have COVID precautions, standard precautions, if we address fall prevention, pain, diabetes, CHF, COPD, and depression monitoring. Leave the ones in there that are appropriate, add any others that you see fit. Comments, this is just any additional information that didn't have a good spot to enter it elsewhere. Okay, so we're going down toward the bottom. You can skip forms. So care coordination, this will copy to that care coordination spot under the episode tab. So these will show up there, whatever you put in this box. This is at the bottom of all of our notes. The only thing here is that this does not give you an option to notify another clinician or your case manager immediately. So if it's anything that needs to go to the case manager immediately or another clinician, you'll want to enter that in the care coordination spot under the episode tab rather than here. So again, PT recommended documentation. It kind of tells you what is supposed to go here and what else needs to be done to complete the eval process. So enter any important information for other clinicians to be aware of, such as dialysis schedule, how to contact the patient, any other requests, things like that. In a separate care coordination note in the episode tab, you'll enter your frequency request and you'll copy and paste the assessment summary that we previously copied. Now don't forget, and we'll get to this in a minute, after you've submitted your note, you'll need to upload an iterator form or a functional impairment level assessment. We'll upload this to documents and I'll show you how to do that in a minute. If the patient requires authorization, you will need to also enter an authorization or a managed care assessment form, and that will be uploaded to the authorizations tab of the patient's chart. It differs how you do that depending on the insurance company. You should be supplied with a decision tree regarding insurance and authorization to help guide you on how to do that. So then we'll check the box at the bottom, scroll back up. I'm going to save it, submit to QA. I'm going to enter my timeout. And then there it says my vital signs are out of parameters. Physician notified. You'd also want to notify the other staff, so that would go in that care coordination note. MD notified. No changes made at this time. Okay. Continue. And there we go. So then we will close out of our note. It'll take us back to our timesheet. Now the visit turned green since it's done. We'll go to there, okay. And then I'm going to add that iterator form. So we're going to fill out that iterator form, the functional impairment level assessment, and we fill out the patient's name, and then it looks like a long form, but it only takes a few minutes. You're going to want to fill out your appropriate responses to these questions. For example, ambulation, this is their current score, and this is the goal score, let's say. That's what we think they'll be able to do. The reason we do this is because we want the most accurate picture for our patient. This is important for all kinds of reasons. But for example, if the nurse sees the patient, they don't have the same training we have as therapists. They may score the patient. They see him walking with a walker. They'll score him as requiring a two-handed device. However, we see them and they require supervision or assistance of somebody else, or you feel like that's the safest is that they have supervision, we would change them to the able to walk with supervision or assistance. Okay, so you don't need to know what the nurse or other clinicians put. The case manager will review all of the documentation or documents and make appropriate changes. So that is, so you'd save that, and then you would upload that under documents, add new, general, clinical, and then you would choose file and you'd upload yours. Okay. And so then you are done with your evaluation. Oh, under episode, I almost forgot. Care coordination. This is where you'd add your note. Requesting PT 2 week 4, effective whatever date. Patient aware and in agreement. That's important. We want the patient informed of their plan. And then you would paste your summary. Okay, and then you would save that. It will give you an option to notify staff. I will often notify the case manager. So it'll pull it up and give you an option to notify people who are involved. And then you can close. And then you're done. And then you have your completed evaluation.